is defined as inability of a couple to conceive a baby even after trying at least 1 year with an unprotected intercourse. Now, infertility affects about 15 to 20% of couples globally, and it has been increasing over a period of time. This could be attributed to lifestyle disorders and so many things. What is very important is for us to understand that infertility could be not only because of the women but also due to the gentleman. So it's important always to test both simultaneously or parallelly so that things are taken together and treated together. In women, there are several causes of infertility, some of which briefly if I can enumerate. One is the most common cause, which is called as polycystic ovarian syndrome. It's a condition wherein there is irregularity of periods, as a result of which ovulation is not happening appropriately and so results in infertility. The other causes are like endometriosis, wherein the endometrium, that is the lining of the uterus, gets into the ovaries and forms cysts there, cause adhesions and lead to infertility. Smaller or rather less common causes like fibroid uterus resulting in problem in implantation. There is tubal factor infertility wherein tubes are blocked so egg is not reaching the sperm. There are other lifestyle disorders like extreme obesity, smoking, excessive alcohol consumptions which can lead to problems. Rising cause at present is also premature ovarian insufficiency. It's a condition wherein women have less number of eggs in ovaries, due to which the conception becomes difficult. Whereas in men, there are a list of diseases that can cause infertility. Especially commonest is diabetes. And uncontrolled diabetes leads to abnormalities in semen parameters. Similarly, unexplained abnormalities in semen parameters like low sperm count, low motility, low morphology, or how the sperms look, if they're abnormal, then all these things lead to infertility. And last but not the least, sexual dysfunction. Nowadays, it's quite common that men are getting too stressed either at work or due to day-to-day demands, due to which there are a lot of problems with testosterone secretion and also stress leading to abnormalities in sexual function. Baseline tests that we start off when a couple reach out to us with complaints of inability to conceive would include a simple sperm analysis for the gentleman. This is extremely important because it's a very simpler test, whereas the tests for the women are a little more complex. So it is first important to rule out that there is a problem with the man. So once we are certain that the sperm analysis is normal, there are a few lists of tests for the women. This would include a list of hormonal tests, which would be like a thyroid testing, prolactin testing, ladies ovarian reserve testing, which is in the form of a blood test called as AMH. This helps us know where do we stand as far as the ovarian reserve is considered. So it's extremely important to know ovarian reserve, basically because this will help us decide how we should handle fertility treatment. If the reserve is going down and the lady is at age between 30 to 40, it's very important to fast track the process to fertility. So if the AMH is low, it's important that we move forward with treatment as soon as possible. But a normal AMH should reassure the couple that they can take it slow and then go stepwise for fertility. The other tests would include a fallopian tube testing. Now, this is a test to know if the tubes are open. Now, tubes are structure which actually connect the uterus to the ovaries, and this structure helps in movement of the egg from the ovary to the uterus and also helps for proper fertilization by the sperm and for the embryo to move into the uterus. So if tubes are not functioning appropriately, especially this happens if there's a history of past infection, in such situations, even with the best of the embryo developing, pregnancy may not ensue. So it's important that tubes have to be checked if they are patent or open. So there are several ways of testing the tubes. The commonest or the least invasive ones are called as HSG, which is an X-ray based testing, wherein we put in fluid into the uterus and see if it is passing through the tubes easily and properly. And there is something called as sonosalpingogram. Now this is a test wherein we put in saline into the uterus and see again the flow of the fluid on an ultrasound. See, both of the tests are mildly painful, so if a pain threshold of a patient is low, I would suggest that they should undergo this under anesthesia. And the gold standard for tubal testing is called as hysterolaparoscopy, wherein we put in a keyhole into the abdomen, put in a scope and check if the uterus, the tubes and the ovaries are normal. Though it is the gold standard, it is not considered as the first line of testing for tubes, basically because it becomes a mini surgery and there will be 1 or 2 scars of about 0.5 to 1 centimeters on the abdomen. So to start off for the tubal testing, I would suggest a sonosalpingogram or a hysterosalpingogram or HSG. Treatment options for infertility are a variety of treatments. It's very important important for couples and doctors or fertility specialists to individualize the treatment according to the condition. So depending on what the diagnosis is, for example, if it's endometriosis or a fibroid, it's very important to tackle the disease first before venturing into any form of fertility treatment. Now, suppose it's an unexplained infertility, that means things are all normal in the baseline tests. For example, hormones are normal in the lady, tubes are good and open, and she's regularly ovulating, and the sperm in the male factor is absolutely normal. In such situations, which we call it as unexplained infertility, the first line of treatment would be an intrauterine insemination. Intrauterine insemination is a treatment form wherein we just reduce the distance between the gametes by putting the sperms into the uterine cavity. Now, this kind of treatment increases the probability of conception, wherein in a general population, if the chances of conception per month is about 8 to 10%, an intrauterine insemination will enhance it to almost to 15 to 20%. Similarly, if there is severe abnormalities in the semen parameters, or if the fallopian tubes are blocked, or if somebody has tried several cycles of IUI, then IVF becomes the mainstay of treatment. IVF, or in vitro fertilization, is a in brief treatment wherein the egg is aspirated out from the lady, the sperm is injected into the egg, an embryo is developed, and the formed embryo is transferred into the uterus, which is called as embryo transfer. Now, this kind of a treatment is extremely efficient. So if somebody forms good embryos, the probability of conception in an IVF is almost like 60% per transfer. However, we tend to decide for an IVF when we have tried all of the methods to begin with.